Just 2 years ago, Golda Kiirti's life changed with one phone call.
What I remember is I was in the bed in the morning with my daughter. We were reading a book, and I got a phone call, and they said that they had got the punch biopsy result back and that it was cancer.
Breast cancer, a diagnosis especially difficult to take when you're in your 30s.
I mean, it's like shattering words. You just can't even think, you can't process it. It is the most earth-shattering news you can get, and everything in your whole world has just changed in 1 second.
Golda was facing a tough fight, including radiation and a double mastectomy. She was also offered an option for reconstruction, called a DIEP flap.
The DIEP flap is a specialized procedure where we take skin and fat from a woman's lower abdomen and transplant it to her missing breast.
Dr. Michael Orseck is a fellowship-trained, double-board certified plastic surgeon. He is the only plastic surgeon in the upstate routinely performing microsurgical breast reconstruction. The DIEP flap procedure Golda opted for is the most advanced breast reconstruction procedure available today.
The way that we do this is we take the skin and fat that we normally discard during a tummy tuck, except this time we preserve little tiny blood vessels that supply blood to that tissue. Once we transplant it, we hook up the little artery in the vein from that tissue to little arteries in the veins in the chest with the help of an operating microscope.
The DIEP flap can be performed at the time of mastectomy or weeks to years after mastectomy. Golda's surgery was a success.
The recovery was fast. They took really good care of me in the hospital, and I didn't really feel any pain. I had the medications, and pretty soon I was up walking like the very next day, and just back to work doing hair in 5.5 weeks. And I just could not believe that I was actually walking and doing things around the house so fast.
With the DIEP flap procedure, patients generally spend less time in the hospital, enjoy a shorter recovery time, have fewer long-term effects, and have a more natural looking and feeling breast.
I really love it. I think it's the best thing I could have ever done. It actually restored me back to my mental image as well as physical. And right away, I did not feel like the cancer took away from me anything anymore. It actually felt very much like my own body. And I like the results better than my natural body was. In fact, I'm just kind of thankful for everything that I had that way. And Dr. Orseck did a fabulous job.
The end result looks great. Unfortunately, anytime we operate, there are usually some small scars, but overall, the woman is very happy because it's her own natural tissue, which stays warm and soft and is with her for life.
Her health restored, Golda's back at work. Thoughts of the cancer returning rarely on her mind now.
I don't worry so much because if it does come back, I can handle it. I've got my faith in my family.
And the full support and care of the team at Spartanburg Regional, where quality health care means providing the best treatment for you and your family.